it's Kim Jas Ramirez here at the Marshalltown YMCA, YWCA. We're finally back open after being closed for a couple of months for the yay! So we are opening in a safe and responsible manner, and so we're doing a phased reopening to make sure that we can get used to kind of our new procedures and new ways of being. We've got plenty of staff here who are helping with sanitizing and cleaning spaces. They're available for members, and we just opened on May 18th, and we're glad to see many of our members are back. We do ask people to use their judgment with wearing a mask. So you can see I have my fun emoji mask here. But you know, we are definitely encouraging people to practice safe social distancing as they are everywhere else in the community. But if you're not able to, or even if you have any concerns at all, we definitely encourage people to wear a mask. And so you'll see some people here with a mask on and some who may not. With our phase 1 reopening, we've opened part of our building. Some of our spaces are not yet open. One of the main spaces that is still closed is our pool, and the reason for that is because the governor's mandate has still covered swimming pools, and so she has asked that all swimming pools still remain closed until further notice. So we do have our gym open, our fitness center, some of our other exercise areas. We're also providing emergency child care for people in need of child care during these times. If they need to go to their job or if they have other commitments, we're providing that as well. So the Y is here serving the community. We're beyond our 4 walls. We have a lot of resources that we're offering virtually as well. Exercise classes on our YouTube page and resources that families can access on our website. But we're glad to be reopened. We're glad to see all of our members here and be back open to the community. So I encourage you to check out all the details of our phase 1 reopening on our website. We are asking people to sign a waiver before they come in. We are also asking people ages, if they want to bring a child under age 14, that youth needs to be accompanied by an adult at all times in the building. So there are some guidelines we'll need you to follow so everybody can be safe and have a good time here at the Y. So check us out at www.ymca-ywca.org. You can give us a call at 641-752-8658. Welcome back.
Hi, my name is Pat Thompson. I'm public health nurse for Marshall County, and it's another segment of Here's to Your Health. Oh.
No, we're just doing, just don't even say that.
Okay. Okay. Hi, my name is Pat Thompson. I'm public health nurse for Marshall County, and I'm glad to be here today to share some more information about COVID-19, or otherwise known as coronavirus, or we can also call it the C word, type of thing, because someday this will pass, but it's not much fun right now. I want to talk today to you about loosening restrictions, and you know what, that's actually even lightens my heart a little bit too, to think we can have more freedoms, but they have to be taken with a good portion of caution. It's not a little thing that we're going to be mingling more. You still need to maintain that 6-foot social distancing, because they have proved that does make a huge difference, and the news says it every day, and we have to take care of ourselves and protect ourselves and protect other people from us. That's what this is all about. So jumping around on a teeny bit, don't want to forget to mention the mask. Please wear a facial mask when you're out in public. When you're standing in your own yard, you're talking to the neighbors across the fence or across the yard, or in my case, across the bicycle path. You don't need a mask then, because you're further than 6 feet away from each other. And that's okay, because that's kind of a joyful thing for me anyway. But when you're out in public, off your own lawn, out of your own home, that's your safety area, consider it that. You need to be wearing a mask to help keep your germs inside of you, and other people should be wearing a mask to keep their germs inside that mask too, so we're not sharing those germs. But you still also need to maintain the 6 feet, and that can be done. Aren't we learning how to do that? I find myself talking to people in the grocery store with a mask on, and maintain that distance. if we're starting to get a little close, I just step back, and we're all used to that because we need to also respect people's space at this time because you can be uncomfortable. And it's kind of amazing that we would think that we would be uncomfortable doing that, but we've all been working on that new way of living for a while. But you know what? Hugs will come back, and they're still there. You can do wide ones, you know, in the air, and people know what that means, but that touch will come back again someday, and we'll be able to hug our children and grandchildren and all those nieces and nephews and brothers and sisters and moms and dads and spouses and friends. So it'll be a good day, won't it, when that happens. So loosening restrictions means that people can mingle a little bit more, and with that comes the risk, of course, of getting COVID-19. And that risk is not overplayed. It is there. You know, we don't know that if you've had the COVID-19 that you have any antibodies that will protect you from it. We don't know that you will or you won't because that's still being studied. They're trying to prove that they do make a difference, and I hope they do, because if you've had it, that means we can have some self-protection, you know, compared to, or your immune system's ready to help you prevent that virus from making you sick. So, but we have to wait for vaccines to come for people that have not been exposed, and we have to still maintain that 6-foot distance, please. Social distancing. Who knew we'd be saying those words together, right? Social distance. Who knew that? But it's true. That's where we're at. So this is, you know, our weekends are coming up, and they're always busy times, and when we really want to get out, especially in this nice weather, and see people, still maintain that distance and still stay home, especially if you have any kind of medical conditions that actually heart disease, lung disease, any kind of neurological disease, you know, we diabetes, all these things that affect our whole body. If someone who is having treatments for cancer or for rheumatoid arthritis or taking medication for that decrease the immune system are people that need to stay home and not let people come into your home. That's the hard thing. Well, I'm staying home. Well, you need to not let people come into your home either. And the only person you know who is safe is yourself. And every time you step out that door, you run the risk of being exposed to the COVID-19 virus. That's just a plain fact. And I know that myself. I rarely go anywhere. I'm doing the show right now, but also I go to the grocery store, and that is about it. And rarely to my office to get some information that I need because it's there and I can't have it at my home. Anyway, just remember to stay home and respect people's space, and try to find that joy. I know we've done plenty of puzzles and plenty of this and plenty of that because it's gone on where maybe the thrill is gone, or kind of, you know, it may not be as much fun as it was before, but there's still important things to do, and they do make a difference. So you need to maybe find that new outside thing that you can do when it's not raining, of course, or not drizzling, and all the things that are going on with our flowers and our gardens, and enjoying maybe some webinars on nature, because I have done some of that and I enjoy that. Paying attention to our birds that are plentiful right now, and keeping them fed, and doing the yard work that we like to do or not, or watch someone else do the yard work, right? That's a good thing. And also, you remember I talked about that lawn chair supervisor to what the neighbors are doing in their yards. That's kind of pleasant, and you get to see what's going on in the world when you do that. The other things you can do would be some of that maintenance work that you've done and want to do on your house, if you're able to do that, or do that cleaning that I've been putting off because I've just been working from home and it's a little full of other things, work stuff, you know, that normally wouldn't be scattered throughout my house. But you know, get some of that stuff done. Go for walks. The parks are opening, and that is a very good thing, but remember your space. I know there's people that enjoy frisbee golf and that type of thing also. So look for those things that bring you joy. Get your exercise or increase your activity, like I call it. Eat a healthy diet. And I know I get questions about vitamins and supplements and that type of thing, and that's something that you need to discuss with your healthcare provider to see if that's appropriate for you, because we also have to think where we're putting our money. So if it's something that's appropriate for you, then you discuss it with your healthcare provider. That's a good thing. And watch our alcohol intake. It's we're hanging out more at home, and so we need to actually pay attention to what we're drinking too. And also wash your hands, use hand sanitizer, cover your cough, all those things that public health says year round. So flu season isn't here yet. Actually, like I always say, flu is here year round. It's when we gather together that you have a greater chance of being exposed, is what it's really all about. As we're finding out with a coronavirus, we have a great chance of being exposed, and we don't have any resistance at all, any immunities to it. So, flu season will be coming. Actually, I'm preparing for it as we speak right now. And in the fall, put that on your list that you need a flu shot, because it's just one of the things that we can do. As we've proven with the coronavirus, someone asked me, is the coronavirus worse than the flu? And I said yes. But flu is dangerous, very dangerous, and people die from that. I have to say it out loud. People die from that. And if you get it, people tell me that they've had it. They know they've had it. That's how sick they get. And if you've been fortunate enough not to get the flu, that's good, but why take the chances? Especially as we get older, we really need to be getting those immunizations that are so important. Make sure you get your, kind of jumping around here a little bit, but make sure also you get your Shingles vaccine. There's a new vaccine that's a 2-shot series that's very important, and it has it's very, very effective. And when our immune system goes down as we all age, we really need that protection from the shingles. And some of us think we don't age, but it's inevitable, unfortunately. Well, yes, it's fortunate, right? So we're very blessed. And each decade brings something new, which I'm discovering all the time. And most times it's very good surprises. So that's all good. So shingles vaccine, flu shot, you keep up with your tetanus vaccine with pertussis, so you can protect those little babies that can't even get the vaccine till they're 2 months old. So you need to get those vaccines to help protect other people. And that's the whole purpose of this too, is protect other people from when we get it and we don't have the disease, we can't give it to somebody else. Talking about environmental cleaning, I get lots of questions about that, and it's reasonable cleaning, high-touch services such as our counters and tables, that type of thing, doorknobs always, bathroom fixtures, those are high-touch surfaces that we should clean routinely anyway. So if you have, by protecting ourselves from, by keeping them clean, these high-touch surfaces, we help protect ourselves from more than just coronavirus. Okay, so it's an important thing to do. I think we've discussed using public restrooms and getting in and out of doors, and using a paper towel and throwing it away. And I think businesses are getting a little more understanding that they need to put the garbage can close to the door rather than across the room. I can see that they know that people do use the paper towel, and when you're standing with trying to keep the door open and all that good stuff like we all do, I've done all that, dance and try to throw the paper towel away. It just doesn't work very well, so they're helping make that better for us. So it's just important to realize when you're out of your home that you also need to pay attention to high-touch services and how we take care of ourselves. Let's see. Well, I was going to talk to you too about that COVID-19 weight gain, that 19 pounds. Try not to gain 19 pounds during all of this, because I find myself looking through cupboards and then not too much later looking again and nothing's changed, but it's just that sitting at home and doing things I don't want to do at the moment type of thing make me want to eat. And so trying to keep everything out of the house is kind of hard, and I haven't gotten down to just plain flour yet. The raisins are gone though, I'll tell you that. I just keep working through all those types of things. No chocolate chips in the house, I wouldn't dare do that, but just kind of keeps the healthy foods in the house because they're just way too easy to just keep munching all day long and trying to avoid that weight gain that isn't good for us anyway. And like I've said too, is maybe this isn't the time to plan to lose a lot of weight because of what we're going through. But if you can maintain, that's great. You know, that's great because it's too easy to put it on. So that's what I would recommend if because that can be stressful. Not, listen, I want to eat something and the ice cream's gone, like I've said, and because I have to go drive to get some, that stops me from getting it too. So let's see, what else do we have?
So if you have the goal of losing weight, then that may help you maintain your weight.
That's exactly it. Yes, you know, just yes, it is, because it's kind of a tough time to do that total. If you are so self-disciplined, I admire that, and I wish I had that. I'm okay. I wish I had that, but like I said, I'm opening cupboards and refrigerator and freezer, and there's nothing there, and I'm too lazy to go out and get it, and I shouldn't be going out to get it. So that's why how I work it. But I have to stay away from cookies and crackers and candies and all that good stuff that we all like. And who doesn't want to go to the get some ice cream at an ice cream shop? I do, you know, in a minute. So it's like that carrot, you know, that keeps me going. Yes, for all those little things. And also make sure you're getting your sleep. You know, they had on the news about people having dreams, and they're kind of nightmares. I have to admit that I had about 2 nights of those. I had 2 bad nightmare dreams that I never have, and I distinctly remembering waking up and having to kind of come out of it a little bit. And I can't remember what they said about we're sleeping a little bit deep, longer sleep. We're sleeping longer can also, you dream more if you sleep longer is what on the news was a news thing. And so I did have that about 2 nights in a row, and that hasn't happened since, but it's something, you know, when we're stressed, that's how it comes out. And so you just really need to think about understanding what that's all about, you know, and maybe we want you to get plenty of rest, but, you know, maybe not oversleeping, I guess would be the way to say it. And you know your body for that. And we know that stress is here. There's all kinds of people around us with jobs that are affected. Even if you're working, it's changed. And so anytime you have a change that you didn't ask for, it's stressful no matter what it is. Even changes that you asked for are stressful, but it's something that we wanted so we can work through it a little bit easier. But things that we don't want make it a lot harder. So job changes, not being able to see our children like we'd like to, or our grandchildren like we'd like to at all, because I haven't, you know. I'll admit I did go to my son's house and walked through his yard for about an hour a few weeks ago on Mother's Day weekend, staying 6 feet apart, didn't get a hug, but we knew that we would someday. But you know, those are some things that I did at that time, and it's kind of embarrassing to admit because I tell everybody stay home, but I did do the things that we need to do when we were outside. But anyway, these changes that are going on, we really need to understand they're not forever, okay? And these things we've had to give up. And so it's very stressful. So understand that about yourself. Know what what stress does to you, weight gain, overeating, sleeping too much alcohol. Those are the things we have to pay attention to because we can. We know how to do that, and we just have to get that self-control and that get back what we had before that helped us to be a little bit better, okay? And also when we have these things that we're doing like overeating or sleeping too much or whatever, it doesn't make us feel better either. You know, it's compensating, so you have to think that, you know, and I do that. I think that didn't make me feel better, you know. So what am I going to do about that? And make some changes that way too. So you can make some positive changes as we're going through these negative ones. And some days, I know we're not at the end. We're not at the end, so that's the reason why we're having this conversation is we're not at the end. We still need to keep doing what you're doing, please. But someday it will end. And it feels a little lighter because we have these opportunities to get out more, but we really need to maintain some of the things you've already done. Don't give up and don't barge out there and mingle shoulder to shoulder with people because you just don't know and you don't want this at all. I promise you that. Remember patience and kindness. We all have to have that. And I have to remind myself about that too. Patience and kindness, because we're all struggling, even if we don't look like it. We all are. Make sure you respect people's space, like I said, and find your joy and peace. And that's something sometimes we have to work at. There's days when I think, forget it, because I'm just like everybody else, I'm done, but we're not. And we can make this, we've done things before we thought we could never do, and this is another one of those things. So hang in there, okay? So, Craig, you have anything for me? Anything else you want me to?
You mentioned good time to work on home projects or even explore new recipes when you're cooking and stuff.
Yeah.
But if it requires a trip to the store, it's a good time to maybe watch how many cars are in the parking lot, pick a different time to go, and kind of plan ahead if you're going to do something like that. Menards is finally requiring face masks in there, so that's good, but there's still people shoulder to shoulder going in and out, so
Yes.
it's a good thing to watch the crowds.
Yes, so everybody seems to be at Menards lately, haven't they? Or places where they can
Because
do
they all
home
have
improvement.
time to work on their house.
Yes, exactly. And we appreciate that. And grocery stores, yes, actually I do look at how many cars are in the parking lot. I always look and think, not today or not now. I'll swing around and come back a little bit later type of thing, because I just don't want to be exposed. I need to do my job, and I love my job, and it's not the end all if I would get sick, because there's always someone that can do your job. We all know that. But it's, right now we're in the middle of this, and I don't want to be sick. So I make the decisions to wear my mask in public, use hand sanitizer before I get out of the car, and then when I get back to the car, I use hand sanitizer again, and do essential shopping only. I do shopping for a dear friend, and that's that gives me joy, actually. And when I go to her house, I don't quite throw them in the door, but pretty close, because that's out of respect for her space, right, and her family's space. So, it's not a visit. It's an essential trip, and it keeps people that have more. I can't think of the word right now. Illnesses, chronic illnesses, diseases, keeps them out of the stores so that they're safer too. That's the whole idea behind this. When I've gone to the doctor's office a couple of times, that has been done very well. They take your temperature, and I wear a mask, and I feel safe at the doctor's office. Seating is spread out. And the bad news is they don't have a magazine to look at, and that was usually my place to look at a magazine, so take some reading if you need to, but they're spacing their appointments. It looks like to me that we're not all waiting long periods of time either, which is great. So I usually get in there, sit down, time to get up and go. And you get in and you get out, and I feel safe and well taken care of. So I wouldn't be afraid of that. Never, if you're sick, always call and tell people before you go in, and get direction on where you should go for anything that resembles any kind of respiratory illness, because they want to take care of you the right way, and they want to take care of everybody else around them, including themselves and their family. So it's we're respecting other people's space, aren't we? Just by following the rules. Following rules isn't always easy or fun, but we've been doing it for years, and that's what we should do. They're there for a reason, and to help take care of everybody. And I know I keep saying take care of everybody, including ourselves, but that's really what it's all about.
Yeah. And your biggest danger right now is people who aren't following rules, and they're out there.
Yes.
Because there are people who don't want to wear a mask.
Yes.
They're not concerned about other people. They're concerned about what they look like, or discomfort, or whatever it is. But the fact that the state has opened up businesses doesn't mean it's safer. It means that they've had to balance safety with economy. So
That's exactly what it is. So I like that, balance safety with the economy, and it's our job as citizens of the Marshall County and Iowa to do our part to keep everybody safe. So, and that is a mask, please. Who knew, you know? And actually they can be kind of decorative, and maybe some of us look better with it on. You never know. So, and I have to say one thing, getting the haircut one of these days, that's going to be great. I have an appointment, but it's not for a while yet. Got to wait in line. There's another line from home, right? Wait at home until it's time. So anyway, be patient and kind. Please be patient and kind, because that's what it's all about. And as we go through this loosening of restrictions, be aware that doesn't mean to go out and have all kinds of fun really close to people. You can still have fun, but respect other people's space and take good care of yourself. And still, if you don't need to go out, don't go out, right? Don't go out. And find your joy and peace. Until next time.